Hello and welcome to this special edition dedicated to COVID-19 and our community responses to this pandemic. I am Carol Merton. First, I want to express a sincere, heartfelt thank you to our Medical Officer of Health, our Public Health Unit staff, our community service providers and agencies, our first responders, hospitals, retirement homes, and long-term care facilities, as well as so many others, for their prompt action and their ongoing efforts to keep our community safe. We are all together in this exceptional and ever-changing situation. We are all neighbors, doing our best to care for each other and to support each other. Rogers TV will be providing you with current information from our community agencies and our elected officials. This information may change rapidly. To stay current with the situation, we encourage you to go on to the Public Health Unit website at publichealthgraybruce.on.ca, listen to the radio, and watch Rogers TV for updated information. Today, I am delighted to welcome as a guest Alice Wannan, who is here to talk about Salvation Army services, as well as any changes that are happening, which I'm sure there are many, to provide the community an update. Alice, I want to thank you so much for taking the time. I know you're really, really busy, so I appreciate the time that you're giving us. First, would you mind outlining your role at the Salvation Army, and then I'm going to turn it over to you to fill us in on where you are, and also how the community can support you in the efforts that you're doing.
Wonderful, thank you. So again, my name is Alice, and I am the Community and Family Services Director for the Salvation Army here locally in Owen Sound. We are predominantly right now focusing all of our efforts on the food bank and making sure that those that are most vulnerable in our community have access to the food that they need to support themselves and their family during the weeks and possibly even the months ahead. We have seen a dramatic increase in numbers. We typically, prior to this pandemic, we're seeing anywhere in the neighborhood of 550 to 600 individuals using the food bank in our own community. Obviously, those numbers do fluctuate a little bit during the Christmas season, but those are typical numbers during the rest of the year. Just these last 9 days, we have assisted over 404 individuals. So a dramatic increase for us, up just over 60% for us. So the days and the weeks ahead are going to be days where we are working together. And again, we always say this, and this time is no different for us. This community comes together to assist those that need help in our community, and we're seeing that now more than ever.
So if I understand correctly, the demand has grown almost the same amount as what you usually serve. Is that correct?
That's correct. So again, in a typical month, we serve 550 to 600. Last 9 days, so not including today, but the last 9 days, we served 404. So we're very close to what we would normally serve in a month, and we've served that in the last 9 days. What we are seeing is lots of new faces. People that have never had to use the Salvation Army services before are now reaching out for some assistance to help themselves or to help their family members. We are taking calls from concerned family members outside of our own community that have family living here and just wanting to know, how can we help them? How can we get food to them? We're certainly seeing folks who we haven't seen for 500, 600, 700 days. So up to 2 years, we haven't seen them, that are now having to come back into the food bank because their situation at home and at work has changed. And our tracking system, our database for the food bank, allows us to see exactly when the last time was they were in. So that's a trend that we're even seeing just today again. folks that haven't had to use us for years are now reaching out to see if they can get some assistance.
So all ages of individuals you're noticing are approaching you for help?
Absolutely. When we moved to this location on 14th Street, we certainly saw an increase in the senior demographic, which we always knew was a demographic that maybe wasn't being serviced as well as they could, whether that was because they couldn't get out as easily. Not really sure. What we do know now is now that we're on 14th Street and right beside two high rises that are predominantly senior based, those folks are now reaching out to us for some assistance. So we continue to see those folks reach out, but we're also seeing those younger families, what we considered before the working poor, that were doing maybe just okay and not having to use our services, but now one or possibly both in the household have been laid off from their employment, and now just can't do it without the help of the social services in our community.
So Alice, do you mind walking me through? I'm at home. I need some help. I don't have enough to go around. What's the first thing I need to do? And then what sorts of services would be available to me as a needy individual in the community? If you could just walk me through that, please.
Sure. So what I will tell you is the system now today is different than what it was a month ago, obviously. 2 weeks ago on March 16th, we met at Public Health for a pandemic meeting, and we implemented right after that meeting what we called our worst case scenario. We wanted to protect our volunteers, we wanted to protect our staff, and we wanted to protect those that were using the food bank. So we moved to what we called our worst case scenario that next day. And so what that entails is quite different than before. But now the process is very effective and very efficient. You basically just phone our office. Our office number is 519-371-0957. We are attempting to catch all calls because we know how frustrating it can be to catch a machine. What I will tell you is we don't always, there were days last week where we were getting upwards of 150 phone calls in one day. It is impossible to catch all of those, but we do have extra people just manning the phones. It is as simple as calling in. What we do then is take two identifying pieces of information, your name and your phone number, your name and your birth date, two identifying. We prefer your phone number just in case we or Public Health or anybody would need to get back in touch with you over the next weeks ahead. That would be our preferred second piece of contact. And then basically all we need to do is arrange a time that works for you to come to our building on 14th Street. We have a big back parking lot, so it allows us to bring people in pretty easily. We set a time of say 10:15. You ring our buzzer system. We can greet you because we have a video camera attached to that. We ask you basically to step away from the door about 6 feet, and one of our workers then brings out the food to you, and you're on your way. So it is a very quick, a very efficient process that allows us to help a great deal of people in a fairly short period of time.
So it sounds like you were very proactive in changing your strategy March 16th.
Well, and again, we were very fortunate. We work closely with our national headquarters, who is obviously very involved in emergency disaster situations. We've been involved in all the community pandemic exercises and information sessions. And that last one on the Monday, December 16th, for basically the social service agencies that were going to be dealing with the most vulnerable, that we left that meeting knowing that we needed to protect those folks. We needed to protect our own folks because we can't do anything to help them if we're all sick. So we put those plans into place the very next day. We made that hard decision to send our volunteers home and to get in touch with those that weren't in that day, to say to them that for their own safety, we wanted them to remain at home. That in itself has created many challenges for us, as we are a staff of 2. So you quickly learn the value of your volunteers in this community when you no longer can bring them into work with you. So we made that decision that following day, March 17th, to bring those protocols into place. And to be honest, it has worked very well. It's worked very well for our community, and it's worked very well to keep our own staff healthy so that we can continue to help those.
For sure. So how often can people come to the food bank to obtain food, and what's included? You mentioned someone brings the items out.
Right.
What would be included?
So 2 really great questions. Prior to this pandemic, we were considered an emergency food bank, so we provided food for up to 5 to 7 days. Now with the current situation, we have tried to add extra food to those hampers. Again, every 30 days was our guideline. We know right now that families have kids at home, they have family at home with them that maybe wasn't at home prior. And so we are doing everything we can to add extra food to those hampers, just to make them extend that little extra period of time. We have also waived the 30-day I don't know if it's a deadline, or that 30-day period that we would ask people to wait. Right now, if people are calling us at 3 weeks or 2.5 weeks and they don't have food at home, then we want to make sure that they do. We're in a position right now, just coming through Christmas, where our supplies were very good. We have seen them diminish very, very quickly over the last 2 weeks. Right now, again, food, they're getting all of those non-perishable food items that people always give during food drives. The canned vegetables, the canned fruit, the rice, the pasta sauce, the hygiene items, all of those that we all know. Right now, what we're really pleased to be able to offer is a lot of fresh produce. So we've got potatoes and onions and turnips and carrots and apples. And our meat supply, thankfully, is better than ever. We've had Pillars Meats, who came last week with 720 pounds of fresh deli meat, which was just an incredible surprise, but certainly has helped to replenish our freezers. I just got a call from a company on Friday that's donating hundreds of pounds of fresh frozen fish for us to give out to our folks. Our freezers are actually probably in our best shape right now to assist people. So our hampers right now are great hampers. We've got milk, we've got eggs, we've got butter that we're able to include into them. So they're good hampers right now. Again, at this rate, we're not sure how long those hampers will continue to look like that, because one of the biggest challenges we're facing right now is being able to purchase food to fill our shelves. And I think we're all experiencing that. We see that at the grocery stores. When you go in to do your personal shopping, it's no different for us. And certainly we've received some government funding. We actually haven't received it yet, but we know it's coming. We want to support our local grocery stores because they're the ones that support us all year long. We want to continue to support them. We want to keep those employees employed in our own community. Our challenge right now is just we can't order that food for them like we have all throughout the year.
So some of the shortages that we as community individuals going shopping and experiencing, you would experience the same kind of concerns, would you?
Absolutely. So just last Friday, I went to 3 of our local grocery stores, and when we're ordering in skids of food right now, because with seeing 400 people or helping 400 individuals in the last 9 days, we knew that 36 cans of soup or 36 containers of juice wasn't going to help us. That was going to do us about a day. So we needed to go in and we speak with the grocery managers about ordering in skids of food. And initially, I mean, obviously our grocery stores are wonderful and we can't say enough about them. They put in those orders right away for us. We were trying to share that around each of our grocery stores so that they were all benefiting from the monies that are being donated to the Salvation Army. And it wasn't too long after that we started receiving emails and receiving calls that unfortunately their head offices were saying they just couldn't meet that demand. And we understand that they need to fill their own grocery store shelves. And we don't want to go in and clear off shelves of juice or water, because then that just puts our community in a position of not being able to access the food they need. But that certainly is our biggest challenge right now, is actually being able to bring in the actual food that we need to fill our shelves. And again, when we're talking things like peanut butter, we're not talking going out and buying a case. We're looking at ordering 750 500-gram jars of peanut butter. So it's a lot of peanut butter. So we understand that whole supply demand thing is going to continue to be a real issue for us in the weeks ahead.
What would you say to the community as far as how they can help you? What can we do?
So again, and I can't emphasize this enough, just about how great our community is, and we've received those donations. It is still okay to bring in food donations. We're in touch with public health. Last week, there is no threat with bringing in food donations. And again, we follow that same process. We talk with them on the phone. We find out a good time for them. They ring that buzzer, we drop them off, we give them a friendly wave and smile and send them on their way, and then we bring that food inside. Obviously, financial donations are wonderful and allows us to go and purchase the food that we actually need. Again, that comes back to then being able to purchase that actual food.
Sorry,
go ahead.
Going back to financial donations, can you explain the process that if people say, I don't have extra food that I can drop off, but I do want to gift money, how can they do that? What do they do?
Yeah, so there's a couple of ways they can do that. Many people still like to do a cash or a check donation, and we can do that. We meet them at the door. We do that receipting process right on the spot. We encourage people, for those that want to use credit cards, we have our girls upstairs who are answering calls, and they can call directly to 519-376-5699. That's actually our church office phone number. They can process those credit cards right over the phone with you. Right. And then for those that like to use the internet, our salvationarmy.ca site, that is our headquarters site, but once you go on it, you can see that there's the option of donating directly to Owen Sound. And so that money then we know comes right directly back to Owen Sound to help our own folks. So those are the three best ways that we can tell people to donate right now. And certainly the response from our community has been wonderful. People are wanting to help, and we see that all the time, and we're still seeing it today in the face of everybody facing uncertain times. Those folks that can are still reaching out and wanting to make that financial donation.
So when you get the call on the phone and someone is needing help, they would identify whether they have children or whether they're a senior. And so you gear the food delivery component to the individual need, correct?
Absolutely, that's correct. And that's never changed. So we do different sizes of hampers. We do small, medium, large, and extra large. And sometimes we have some families that have 11 and 12 members living in the house. So sometimes that means they're getting a large and an extra large hampers. Those haven't changed at all. So if you phoned in and you told us that you had 5 people living in your household right now, we would prepare up a large hamper for you. Again, you would just meet us at the door, you'd buzz, we'd let you know just to step away from that door, and we'd bring that food out to your family. So again, that food isn't going to last you 30 days, and it was never meant to last 30 days. It was an emergency food bank, but we are putting in extra food, extra non-perishables, and we are putting in lots of perishables. And like I said, that milk and eggs and bread, although bread is a scarce commodity right now. We used to pick it up every day from our grocery stores, but for anybody that's been in our grocery stores and trying to purchase bread, that is one of the items that is a little hard to find. So we haven't had that just to give away as plentiful as we'd like. But again, those that have it have donated some, and we continue to give it away as quickly as it comes in.
So it certainly sounds that every effort is being made to ensure the nutrition is there, that people are able to stay as healthy as they possibly can with what you're able to provide, for sure.
Absolutely.
Sorry. No, that's fine. The Skype to Skype is a whole new technology for us.
It is.
Yeah.
It is.
So a question regarding people calling in who've never accessed the food bank. I imagine for some it would be challenging, it would be difficult. We want to respect the dignity of all people who need help. How do you phrase it? What do you say to people when they call who've maybe never accessed or wish they didn't have to come back, but they have to come back? How do you deal with that?
You know what, that is such a great question, and it really does apply for those people in our community who have really never had to use the food bank before. And it's one of those things where we really make an analogy like you would the bank. Sometimes you're able to deposit in that bank, whether it's your financial bank or whether it's the food bank, and other times you need to make that withdrawal from the food bank or your financial bank. And when you put it in that context, it really helps to bring home that, you know what, this is going to be the reality for many of our people in our community. And we try to assure them that, you know, we've known in the past you've assisted us, whether that's through volunteering or whether that's dropping a food bank item in our food boxes in the grocery store. And now this is your time to access that. And when you can have that small conversation with them, and I think hearing that friendly voice on the phone that says, it's okay, we know that this is our reality for the next few weeks and months ahead, but it's not always going to be our reality, that it puts people at ease a little bit more. And we always hear from those folks, I promise you, when things get better, we will be that family that donates again. And we assure them that we are thankful for that. We don't expect that, but we appreciate it. And I think that for them, it's that way of being able to give back again. They need to use it right now, but they will give back when they can. And that is the whole concept of any bank. You put in when you can, and you withdraw when you need to.
Yeah. Alice, you mentioned that there are two people who are doing all of this because you've had the volunteers for their safety. You've asked for them to stay securely home. How are you taking care of yourself?
Well, it has been long days, and we are social isolating ourselves here, even in the offices. We again, starting that Monday, the 16th, we started making sure our office doors were closed. Now, we're fortunate we have windows, so we can talk back and forth through our windows. But we put those things in place right away to maintain that distance between us, because the last thing we do want is for both of our staff to go off sick at one time. Now, again, part of our pandemic planning was making sure that we had something in place should that happen, and we do. So it would not mean the closure of the food bank should Paul and I both become sick at the same time. But those, because we are a food bank, we already had those food or the hand washing protocols really well in place. We were obviously very concerned with food security at all times. So those weren't big changes for us. We were always hand washing. The biggest change for us was not to be sitting at each other's desks and talking, that instead now we talk from an 8-foot distance between our offices, making sure that when we're touching those door handles or walking out of a room that we're disinfecting those handles. So those things we obviously didn't have in place as much, but we've implemented them now. And thankfully, we're both still healthy, we're both still well, and we don't foresee that change.
I'm knocking on wood. You know that. I'm knocking on wood for that.
Us too.
Yeah. As far as, I know we've been discussing food, are there other programs that people would be using at this particular time that you want to communicate? And also, does the Salvation Army do other things besides food? For example, activity bags for kids or anything?
Yeah, so we have lots of different activities that the Salvation Army does and other programs. Right now, all of those programs have shut down. We are focusing all of our efforts on the food bank. Most of all of those other programs did involve contact, whether that was supervised access, or we were thankful the day before, 2 days prior to us implementing these new measures, we were able to hold our income tax day clinic. So that was wonderful. We were able to get in a good number of people and get their income tax done through BDO. So that was wonderful. But all of those programs right now have had to shut down. And I think that's where people are struggling the most. That social connection is difficult for people at the best of times. Many of the folks that we see, sometimes we were that only social connection that they had. And so being able to come in and sit in the office and chat for a few minutes, that was important to them. That's really difficult to do now in a parking lot. And again, because we have so many people coming in, we're wanting to get them back into their vehicles and on their way so that they're not interacting with the next set of folks that are coming in picking up their food. So that's been really difficult on us as well as them.
Yeah, I know. I can't believe our 30 minutes is up already.
Oh, wow.
It's wonderful. I want to thank you very much for joining us today. I want to thank you and all of your staff and, of course, volunteers.
Absolutely.
For all that they do. Thank you to our viewing audience for joining us for this special edition COVID-19. Stay healthy, stay safe, and be kind to each other. Take care.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Wednesdays at 7:30 p.m., it's the RTV Quiz. Giovanni Petiti hosts a weekly trivia competition that lets you play from the comfort of your couch. Play along at home and challenge your friends. And don't forget to follow along on social media. Let us know who's top of trivia, and you can find yourself featured on a future episode.
Are you kidding me, folks?
The RTV Quiz, Wednesday nights at 7:30 p.m. on Rogers TV or at rogerstv.com/RTV Quiz.